owners. And Jessica, whenever you're ready, please feel free to begin.
Hello, everyone. Thanks for having me here today. So what Jackie said, we're basically going to start going over the very basics about mass health, and it's kind of an onion that you have to continue to peel. So I'm hoping that the information that we included in this PowerPoint will be helpful. But again, as Jackie said, if you have questions or if there are other items that you want to learn more about, we're more than happy to share that with you. I will preface this by saying a lot of what is in this PowerPoint is all stuff that's going to be available to you on the mass.gov website, and I've included links to help make it easier. So before we begin, I just wanted to provide an overview of the most common mass health coverage types, what they are, who is eligible, and then I've included a link below. When you get the PowerPoint, you can search. It's a chart of covered services. So it shows exactly what the different coverage types are and what they cover and what they don't cover and how they differ. So for individuals who have disabilities, the most common types of coverage you're going to see them have are Mass Health Standard and Mass Health Common Health. However, Mass Health Standard is also available to income eligible individuals who are caretakers for children under the age of 19, who are pregnant, who are undergoing treatment for breast or cervical cancer, who are HIV positive, young adults who are income eligible, and children who are income eligible. Mass Health Common Health has very similar coverage to Mass Health Standard. The difference between Mass Health Standard and Mass Health Common Health is that individuals who are not eligible for Mass Health Standard based on income will be eligible for Mass Health Common Health, and in some cases have to pay a premium, which we'll explain a little bit later. Mass Health Family Assistance is a program for children and young adults, usually ages 1 to 19 or 0 to 19, really, who are at or above 300% of the federal poverty level, which for a family of 4, and I'm going to again explain this further in explain this further in an upcoming slide. A family of 4 to be eligible for premium or family assistance is around $95,000 a year. So that's a good amount of income that you can make and where your children might still be eligible for Mass Health who are not disabled. Mass Health Care Plus is a program that is for individuals who are ages 21 to 64 who are not disabled but are income eligible to receive Mass Health services. Mass Health Limited is for individuals who do not have documented immigration status or in process of it or cannot produce it at that time for whatever given reason, then they're at least eligible for this Mass Health Limited, which is exactly what it is a limited coverage to help people who are in crisis or having major medical events to become stabilized. And then the Medicare Savings Program or the Mass Health Buy-in, more common for elders who are over the ages of 65, who need assistance paying for their Medicare premiums. However, those individuals who are eligible for Mass Health Standard are also typically eligible for Mass Health to cover the Medicare Part B premium, which can be costly. It's around $160 right now. And then I just wanted to share briefly, this is Mass Health Income Standards and Federal Poverty Guidelines. This was effective March 1, 2024. I assume it will be updated on March 1st of 2025. And it shows, basically what the income limits are at certain levels of the federal poverty level. To be income eligible for Mass Health Standard, Mass Health Care Plus, I'm just going to throw this number out there. You have to be at or below 133% of the federal poverty level where there is a small disregard. However, like I said, family assistance, you can be up to 300% of the federal poverty level. And then for Mass Health Common Health, there is no income limit, but you do have to pay a premium. So again, like I said, Mass Health Standard and Mass Health Common Health are the two most common types of coverage for individuals with disabilities. Mass Health Standard, again, you have to be at that 133% of the federal poverty level or below. However, Common Health, your income can be higher. And then I just put a couple of charts that are right from Mass Health regulations to kind of help explain what you might see for Mass Health premium when you have Common Health. So there's a range that you can look at. So there is no premium until you're at 150% of the federal poverty level. And then it goes up by a certain amount of money. And then at the next federal poverty level, it goes up a little bit more and a little bit more and a little bit more until you get well above 100% of the federal poverty level. However, if you have private health insurance, primary health insurance, your loved one has primary health insurance, then MassHealth is going to decrease the premium because having primary health insurance in place helps decrease the cost to cover an individual. So even though you're looking at, like, say a family makes $120,000, that premium might feel a little bit difficult or not affordable. However, once you factor in your family's primary health insurance, it might seem more affordable and be more beneficial to help cover secondary expenses, and then maybe programming that's not covered by primary health insurance. In terms of disability, MassHealth accepts proof of disability from the Social Security Administration. So if somebody is deemed disabled by the Social Security Administration, they're going to automatically be deemed disabled by MassHealth. MassHealth just has to do a database check to match the disability. However, someone can apply for MassHealth on the basis of disability and not have Social Security, but need the medical benefit. I've done several of these in the past for individuals who are still working, but had some complex medical issues, which was very helpful to cover any additional costs for services that they were having. There are two forms, and I've included the link to them. So one is a form for adults, so those who are over the age of 18, and one is for children who are under the age of 18. You can usually always get help applying for MassHealth coverage from an assister organization. So like I said, or like Jackie said, I was a certified application counselor. What we do as certified application counselors is help people apply for MassHealth and benefits. And typically when you're going to a certified application counselor, they have a good handle on MassHealth eligibility and the regulations. Navigators are another assister organization. They have a little bit more ability to help answer questions about what plans to enroll in, what makes the most sense for you. However, either organization is going to be able to get you through the eligibility process. And then the third is MassHealth enrollment centers, which typically you can go in and do an application. However, there are only a handful in the area, or in the state of Massachusetts rather, and sometimes wait times can be lengthy. Same thing goes for certified application counselors and navigators. I have included the search tool on the website to see where you're able to put in your zip code and see where you can get help. You're always going to want to call ahead because a lot of these agencies work on a appointment basis, so you don't want to just walk into somewhere and then not be able to get assistance. However, sometimes it makes sense for us to be contacting MassHealth directly on our own. Customer service can help you through an application if needed. But I wanted to share some tips and tricks when calling customer service because sometimes it can be very difficult and it's hard to accomplish whatever you're calling for. So I provided the MassHealth customer service number. You want to keep in mind that when you're speaking to someone, you are not speaking to someone who is necessarily trained in MassHealth and their regulations, but who is a trained customer service representative who has a list or a script of things that they typically handle on a regular basis and where to connect people. When calling customer service, it's always best to call right at 8 o'clock in the morning. That's when they first open. That's usually when you have the shortest wait time. It is very important, especially when you're doing like something like changing a health plan, requesting something to be processed, making sure that you get a reference number to the call. So if there is an issue, if the enrollment doesn't take place when they said it was, or if you're now receiving a termination notice because proof of residency wasn't processed, but you asked proof of residency to be processed, having that reference number to call back with is always going to help your case and get your concern escalated. If you are looking for something that is eligibility based, so you're checking the status of an application, you're checking to see if certain verification documents were received, then you may want to ask for them to transfer you to a MassHealth enrollment center. Sometimes they will, sometimes they won't, but if you are transferred to a Mass Health Enrollment Center, you are then speaking to someone who deals directly with Mass Health eligibility. And if you ever get to the point where you feel like you're not getting the answers that you need, or the customer service representative is not providing you with information that you feel is accurate, you can always request to speak to a supervisor and put in an escalation request to a different department who will be able to help you with your issue. It is not a foolproof system. Sometimes it can be difficult. Sometimes you need to call multiple times, but this is usually the easiest way to accomplish something when you're trying to communicate with Mass Health. Do not mail anything to Mass Health. I say this time and time again. They are inundated with mail. Mail gets lost. There's typically no way to track it unless you send it certified return receipt. So if you feel like you need to send mail to Mass Health, if it is time sensitive, you definitely want to send it certified return receipt, so you have that information in the event that mail is not lost or it is not coded correctly and entered for your household. Usually the best way to send mail is or the best way to send documents to Mass Health and or the Health Connector is using their coverage or fax cover sheet, which is right accessible online, and it gives you, instructions on where to send documents. And then you want to always make sure you get the fax verification for receipt in return. So if Mass Health says, hey, we never got those documents, you can say, well, actually, I faxed it on this date at this time and it was sent through. Typically, they say, okay, refax it with that date, and then they honor it. So this is usually the easiest tool to get documents to Mass Health. Applying for Mass Health, if you are under the age of 65 and your loved one is not in a home and community service-based waiver. So that meaning they are not in a long-term care institution, they are not receiving a home and community-based service waiver program through DDS, the Frail Elder Waiver, or Mass Ability. The best way to apply for Community Mass Health is online. You'll notice that the online application shows Mass Health and the Health Connector. We are not reviewing what the Health Connector is today, but I just want to mention what it is so you understand why they're together. So the Health Connector is the insurance marketplace. So those people who are not eligible for Mass Health because they're over income may be eligible for a plan through the Health Connector that is subsidized by state subsidies and federal tax credits. And they pay a premium based on income if they're not offered affordable insurance through their employer. So that's just how they work hand in hand, but they really are kind of two separate programs. Mass Health documents are processed by one entity, the Health Connectors information, documents, all of that are processed by another. So like I said, it is best to do the application online because you get real-time eligibility. So if you enter all of your information, all of it is correct, you're going to get a real-time Mass Health determination. If they're requesting documents, you can also upload them directly in your application, so you don't even need to fax them anymore, which is kind of cool. The only thing I will caveat with this is you do not want to duplicate applications. So if you've applied for Mass Health within the last 10 years, Community Mass Health within the last 10 years, it is more than likely that you already have an online application established. There are ways to get access to it if you don't remember necessarily the username or the password, and that's when you're going to want to call Mass Health. You don't want to duplicate applications because if you do, you're going to get an error and it's not going to let you to continue. For individuals who are over 65 or in a home and community service-based waiver, so they have a DDS waiver, the Frail Elder waiver, a Mass Ability waiver, there's the senior application for people needing long-term care services needs to be completed. This cannot be done online. With this application, there's an income and asset test that is done by Mass Health. So it's not going to only ask for income, but it's going to ask asset questions. And those applications should be faxed directly to Mass Health Central Processing Unit, which is clearly indicated on that fax cover sheet that we just went over. And I provided the link to the documentation. You always want to just make sure you're using the most up-to-date form because Mass Health does update the forms. And I actually have had it in the past where I downloaded an application 2 years ago and it's not the correct information now, and they won't always process it. So it's just good information. If you are looking to do this application, it's been a little while, go back and pull it off the website. So if there were any updates that were done, you have the correct application. MassHealth renewal process, and I caveat this with it's not always cut and dry. So typically MassHealth members are supposed to be renewed on a yearly basis. However, that does not always happen. It is really important so that there's not a gap in coverage that you're completing your renewal before it's due. Even if it is not processed right away, MassHealth will protect the current eligibility if they receive the renewal, as long as it was received on time. And again, if you're doing a renewal and you're like, oh boy, I don't have my proof of residency documents handy, I don't have my income documents handy, submit the application anyway. They can send requests for those things, and then you have 90 days from the request date to submit those documents to MassHealth. If a renewal is not submitted on time and coverage does end, but you do submit the renewal application within 90 days of the termination date, you should be eligible to call MassHealth and request backdated coverage so there is no gap, as long as it is completed in that manner. Sometimes MassHealth is able to do an electronic renewal. So this typically happens for individuals who receive a supplemental security income. They're typically automatically opened a MassHealth case when they become eligible for supplemental security income through Social Security, and it is updated electronically. Usually you get a letter in the mail saying, good news, we were able to electronically verify all of your information. As long as nothing has changed, then your coverage continues and you don't need to submit anything to MassHealth. This can also, in some cases, happen for individuals who aren't necessarily in one of those programs who we expect to get auto renewed, but there have been no changes, and MassHealth is able to verify your loved one's residency, income, with all of the electronic systems they have access to, like the Department of Revenue, which you're giving them permission to check your information when you complete an application. I will say, if you think you're ready for renewal or you have moved, you want to make sure that MassHealth has that information and they have updated your address. And sometimes it is not enough to just call them and update the address. You want to make sure the actual update has gone through and you're getting mail to your new address, because sometimes it doesn't always work. So just make sure that once you move, you've updated your address and then you received mail at the address you are currently residing in, so that you don't fall into that scenario where a renewal was sent to your old address and then you don't receive it. Also, MassHealth does not forward mail. So if your address has changed, your mail goes back to MassHealth as undeliverable, it's most likely you will get terminated until you provide them with your new address. MassHealth often requests verification documents if they can't verify information electronically. The most common are proof of residency and proof of income. They might, though, if you're doing a new online application, they do a soft credit check to prove your identity. If you don't have credit, sometimes that check can't happen, so you have to provide proof of identity. So some of those things are things that MassHealth or the Health Connector are going to request. Proof of income. They always typically request your 2 most recent pay stubs that are dated within 60 days, the most recent tax return, but you usually have to send the most recent federal tax return and all of the attachments. You can't just send the first couple of pages. They typically don't accept that. You can send your Social Security award letter if that's what you're on. However, sometimes people don't have any income and they don't know how to prove that to MassHealth. So there is a form available to you on the Health Connector and website that's called the Affidavit to Verify Zero Income. You or your loved one, whoever needs to provide their proof of income, fills out this form, signs it, and faxes it to MassHealth. This suffices as proof of income. There are other ways to provide income information if, say, you are self-employed, you haven't filed a tax return, and on That previous slide where I sent you to the directory of what MassHealth accepts, you'll be able to see the whole list of what they accept for income, residency, whatever. I just picked the most popular. Same thing with proof of residency. Some people get caught up on this because usually when you are approving residency, you typically need to show the copy of your deed, your most recent mortgage statement, if you're renting, a lease, and your most recent rent receipt, or a current utility bill within the last 60 days. However, if you do not have any of those things, or if your loved one is the one who's eligible for MassHealth and they are not on the lease, do not have any utility bills, you then can find this form, which is the affidavit to verify mass residency, which can be filled out and submitted directly to MassHealth. This form is another really helpful tool. And again, I know I'm talking about two different types of renewals in community MassHealth versus long-term care MassHealth. But when you're looking at long-term care and completing that SACA 2 application, or your loved one is in a home and community service-based waiver, if they are requesting financial information like bank statements, this form can be filled out and sent directly to the financial institution, who then will provide the bank statements of whatever is requested on this form at no cost to MassHealth. Sometimes this can be difficult for families or individuals in general to get their bank information. So this is a great way to be able to get those documents sent directly to MassHealth without having to go to the bank or print them out. Or, a lot of the times if you go to the bank and you request them to print out your statements, there's a fee. This will help kind of navigate through all of that. MassHealth recently piloted a website called My Services. So this can be very helpful because if you enroll in it, this is different than the online application, but you can connect it to your online application if you're doing one. When you log into this, you can see your current eligibility status, and you can also see all of the notices that MassHealth has sent to you. So if MassHealth, for instance, sent you a renewal notice and you haven't updated your address yet, or you tried to update your address and you want to see if it has taken place, then you're able to log into this website and view those verification documents. I believe it is still a work in progress. This is not my strong suit anymore because I'm not constantly helping people apply for community Medicaid. So sometimes you can't see everyone's documents, but it is a great place where all of that stuff is stored. And it can be helpful, especially if you're waiting on something. For me, I've assisted a few people with doing MassHealth disability applications, and they were able to see their disability approval before it even got to their house. So it is something that is worth looking into, and this is the link to it. It is pretty user-friendly to set up. MassHealth representative documents. I think this is a really important topic, especially if you are the one who is always assisting your loved one get their MassHealth documents and renewals submitted, if you're helping them enroll. So there are two MassHealth representative documents that are important to touch on, which is the authorized representative designation form, which allows an individual to act on someone's behalf, and then a permission to share information form, which just allows MassHealth to share information with whatever entity is appointed regarding your loved one's case. It could be due to eligibility, which is typically just for eligibility documents, but you can ask for other things such as claims or treatment records, those kinds of things. So I'm going to go into a little bit more detail between the two different forms. The authorized representative form is usually the most important. If your loved one or whoever is applying for MassHealth wants to appoint you as their authorized representative, or if you have legal capacity to act on someone's behalf. So if someone is their own person and able to make their own decisions, they can appoint whoever they want to be their authorized representative. And that is when you would fill out section 1 of this form. Typically, authorized representative designation forms never expire. And again, this is going to allow whoever is appointed on this form to act on the member's behalf. The other important form is section 3. Section 3 should be filled out if you are your loved one's invoked healthcare proxy, you are their guardian or you're their power of attorney. Sometimes, usually more so than not, at least in my experience, even if you've submitted guardianship paperwork to MassHealth, if you don't submit the ARD with the guardianship paperwork, it's not always processed correctly. However, once you submit the ARD, the guardianship form, it is processed correctly. These typically never expire. And anytime you're calling MassHealth, they're going to see that you are that person's representative and there should be no issues talking to you. Because I know several times I tried to call MassHealth regarding my loved one, but they wouldn't talk to me because they don't have the forms on file. So again, the best way to get them to them is going to be using that fax verification form that I sent you, or that I listed in the previous slides, completing the ARD, and then putting the guardianship, the invoked healthcare proxy, or the power of attorney with it. Section 2. I don't love using this form, and the only time you want to use this form if there is in my opinion, a sudden change in someone's ability to make their own decisions, and they absolutely cannot make their own decisions at that point in time, and there is no appointed legal representative, or maybe you're going through that process and it can be timely. So that's when you would use that form. But typically the most common forms you're going to use are Section 1 and Section 3. The permission to share information form, again, that just allows individual or MassHealth to share information with the designated individual or organization regarding your loved one's case. Sometimes this can be helpful, especially if you're in a move, because they're going to get any renewal notices, any termination notices on your loved one's behalf. So it might be worth doing if you work with a certain organization, they're helping you through the process to have a permission to share information form on file. Unlike the ARD, the permission to share information forms expire, and they expire if you don't indicate a specific time period a year from when they're submitted to MassHealth. The MassHealth appeals process. So sometimes, you have to submit an appeal to MassHealth, and you're going to do this by filing a fair hearing request form. You're going to do this in the event that MassHealth has made a decision that you disagree with, or if they have not acted timely on an application, verifying documents, things of that nature. Once you get that letter from MassHealth determining whatever it may be, for instance, it could be eligibility, that there's an eligibility issue that you're dealing with, or let's say your loved one is maybe in the PCA program and they've decreased their hours and you know that it's not correct, you probably are going to want to submit an appeal to MassHealth. You have 60 days from that notice that you received from MassHealth to submit an appeal, and it is calendar days. The best way to get a fair hearing request form to the Board of Hearings is to fax it to them, and I've included the fax on this slide. Again, just like any other documents you're faxing, you want to make sure you obtain that fax verification receipt. When you are appealing with MassHealth, you are allowed to appoint one appellant representative. If you are having an appellant representative, it's best practice to send the ARD and supporting documents to the Board of Hearings as well, in case that information is not shared from MassHealth. And it is your choice to appeal in person, by phone, or by now video conference. So you don't always have to show up in person. For me, we live in Berkshire County. It's really hard. The closest MassHealth Enrollment Center is an hour and 30 minutes away. So it's hard for our individuals to get there. So you can request it be done via telephone or online, via Zoom. And it can be an effective way of accomplishing what you need to accomplish if you've called MassHealth and you have not gotten what you needed. My caveat to that will be you want to make sure you have any documentation that is relevant to the reason why you're appealing, that it is sent to the Board of Hearings. You can send it directly to the Board of Hearings, or sometimes the hearing officer would request more information, at which case they might leave the record open for another week or so to provide whatever documentation that is. And I know the 120 days from timely not taking action doesn't make a lot of sense, but let's say you submitted a MassHealth application, it hasn't been processed. You've now waited 60 days, it's still not processed. MassHealth's regulations say they have 45 days to process an application from the time they receive it. But again, they're very busy. You know, sometimes things get missed, sometimes things don't get coded correctly. That is one of the times where you may submit an appeal. And if you are submitting an appeal because an application wasn't processed, then you want to make sure you're submitting the application that you sent to MassHealth with that time-stamped verification on when you faxed it to them, because that will help with the appeals process. And sometimes it can seem scary, but it's often really, it's just an appeal officer from the Board of Hearings who's going to go directly through what to expect, what not to expect, how you're going to handle the situation, and then a representative from MassHealth. And it kind of just gives you that third party ability to have a conversation. Maybe MassHealth needs to double check their regulations, whatever. Sometimes this is the best way to get to where you need to go versus trying to call MassHealth over and over again and not always getting the right answer or different answers. Sometimes you have to submit an appeal. The MassHealth third-party liability indicator form. This form is very important. If your loved one has primary health insurance, MassHealth is considered the payer of last resort, meaning any other insurance needs to be billed before MassHealth will pay a claim. You want to make sure that if your family has primary health insurance, that it is listed with MassHealth so that anytime claims are submitted, there are no issues with payment. You're also going to want to submit this form if you, let's say, had primary insurance and it's ended, so that you can enroll your family, your loved one in a MassHealth plan that meets your needs and services your coverage area. So like I said, if you have MassHealth only, you have to enroll in a plan that manages your care. Typically, you want to make sure that the plan that you are enrolling in is accepted by the primary care provider and the other providers that your loved one sees, and it's covering their medication. Sometimes there is not a lot of choice in plan eligibility depending on the providers around you, and you have to work with the plan that's in your area. If for some reason you are in a plan, it's no longer working, but you're in what's called a fixed enrollment period, which happens once a year. You have a 90-day period where you can change your health plan. There are a list of acceptable reasons why you might want to opt out of a health plan that MassHealth will accept and allow you to change outside of fixed enrollment. So that's just something to keep in mind. And I actually included a picture of the website about where you enroll. The link I provided will get you here too. You can enroll in a plan here. You can compare plans, make sure the plans have providers. It's always sometimes helpful if you're looking at a specific plan to go directly to their website and figure out exactly who they accept for providers, things of that nature. MassHealth premium assistance. So this is something that I don't think is always widely shared, or people don't know a lot about it, but it can be a very helpful tool. So remember back when I said if a family of four may be eligible for MassHealth family assistance at up to $93,000 a year. And again, I'm just going to throw this out. It's based on your pre-tax income, but they allow pre-tax deductions to be taken out. So that is how, when MassHealth looks at income, it is not after taxes. However, it looks at income after pre-tax deductions. So premium assistance is for those individuals whose someone in the household is on a acceptable MassHealth plan, which would be MassHealth Standard, MassHealth Family Assistance, in some cases MassHealth Common Health. The policyholder lives in the house. It meets the premium assistance basic benefit level guidelines, which the majority of plans in Massachusetts do, but sometimes the deductibles are too high, those kinds of things, and premium assistance would deny the application at that point, but it is always, in my opinion, worth trying. Then what this program does is anybody who's in the household who's eligible for MassHealth will get MassHealth secondary, have the primary insurance that the policyholder has from their employer, and then receive a reimbursement each month of part or all of the premium. So it can be beneficial to the family because it helps cover that pretty high family plan cost, which in some cases can be difficult to afford. And then it's also beneficial to your members in the household who are not on MassHealth only. They have primary health insurance because sometimes it's more widely accepted. And then it's also beneficial to MassHealth because there is a primary payer source with MassHealth paying secondary. One care plans. So back when I started working at Berkshire County Arc, the state of Massachusetts had started an initiative to auto-enroll individuals who are eligible in one care into one care plans. So what a one care plan is a plan that combines Medicare and MassHealth to one single plan. Sometimes you, like I said, you can be auto-enrolled, but it is optional and you can opt out of a one care plan. So to opt out of the one care plan, you either have to call MassHealth Service and customer service and put in a request, or fax the one care enrollment decision form to MassHealth, which I've included a picture of what it looks like, and then you can find it right on the one care website. If somebody is newly enrolled in a one care plan, there is typically a 90-day continuity of care period where you, your family providers work with the one care plan to ensure there's no gaps in services while they're obtaining the proper prior authorizations, referrals, whatever they need. Before enrolling in a one care plan, I would definitely look at and educate yourself about what one care plans are, how they work, who's in the provider network, and how they cover insurances before you decide if it's right for you and your family. And again, if you get that auto enrollment notice, you do have the ability to opt out. Typically, if you opt out of a plan, it takes effect the first of the following month. So let's say you've submitted a one care enrollment decision form to MassHealth today. Typically, it should get processed and your loved one would go back to traditional Medicare and MassHealth on the first of the following month. So if we did it today on January 22nd, then February 1st, you should see the change. But again, sometimes things don't always get processed timely or they get processed after the fact. That is why it is so important to make sure you're getting reference numbers to calls and fax verification documents so you can say, well, I did submit it here and it was maybe processed, after the fact, but can we please retroactively disenroll me back to the first of the month, which I'm entitled to. So that's when those types of things can be very helpful. And then I just wanted to share a quick slide about the MassHealth Ombudsman program. There's a couple of different types of MassHealth Ombudsmans. There's a community ombudsman that can assist members with concerns and complaints regarding home health care, community-based programs, home-funded programs, and federal private pay elder care programs. Then you have the long-term care ombudsman. Typically, the long-term care ombudsman, there's a representative in each kind of geographical area, but there is a main line that you can call. And this is if you're having concerns for somebody who is currently residing in a nursing home, a rest home, or an assisted living facility. And then there's a My Ombudsman program, which is an independent program that can assist members with issues or questions or concerns regarding MassHealth and their services. And their contact information is also listed. And you can go to their website as well to look at more information. So I know I just threw a ton of information at you. It was very kind of basic. Obviously, MassHealth is not a one size fits all program. There's a lot of different parts to it. So we hope that this was the information you guys were looking for, but I'm happy to try and answer whatever questions you may have in the time we have left.
So we do have a bunch of questions, and if you want to stop sharing, I know there's one other slide. If you want to just show, we have included our contact information. Jessica's kindly offered to be available by email if you have a specific question that she could help with. And I'm very interested in what else you need to know about MassHealth for our next in the series. We do have a bunch of questions, so I thought we could start right as they came in. And if you want to speak, please, as I said, raise your hand and we'll call on you. Do you want to stop
Can I just
sharing?
make one point? I'm very sorry, but I mistyped my phone number in this. So I will make sure that I update it when it goes out with the presentation. It's 449-3383, not 93. I'm sorry, I didn't catch that, but we'll make sure I
Good
update
one.
it before we send it out.
3383, not 93. Got it.
Yes.
Okay.
I'll go ahead and stop sharing now.
All right. So, first question that came in, and I didn't want to interrupt you during the presentation because I know it was a lot of information. You may have already answered this. When we talk about the renewal process, is that the same for people receiving SSI? I think that was in your exception slide, right? If you're getting SSI, you might not be in the typical annual renewal.
The only caveat I will say to that is sometimes, again, if they can't electronically verify information and your loved one is on a home and community service-based waiver, or they are in a long-term care facility, you might see a renewal form.
Okay, so this is a question regarding my daughter has a part-time job, does not have the option to get insurance through her employer because it's only part-time. We would like to take her off our family plan through my wife's employer because it would drop the premium and move her to the standard plan. Would she have access to secondary coverage with MassHealth if she stays on my wife's coverage?
So it depends on a variety of factors. One, if you're claiming her as a tax dependent. Two, if she is disabled, not disabled, that could have an impact. And three, if she's income eligible. So if you're claiming her as a tax dependent, then unless she's disabled and over the age of 19, your income is going to count towards the household. So the short answer would be no. If you're not claiming her as a tax dependent, or she is over the age of 19 and she is considered disabled, then she most likely will be eligible. If you're not claiming her as a tax dependent, she is not disabled, she is over the income guidelines for, let's say, MassHealth Standard or MassHealth Care Plus. If she's not disabled, then she could apply for connector care coverage, where you pay a premium based on income and you're not offered affordable insurance through your employer. So it really all depends on your household composition. If you're claiming her as a tax dependent, not claiming her as a tax dependent.
So this one is never received a request to renew my son's MassHealth coverage. Is this a form that gets sent out annually? That's a depends one too.
It
Right?
really depends. I know that during the pandemic, MassHealth renewals were paused and no coverage was terminated. So they are kind of catching up from that bit. If somebody is on SSI, they're traditionally open to MassHealth case. You don't typically receive a renewal. Sometimes your case doesn't get renewed. You can always call MassHealth. You can enroll in that My Services kind of self-service program. You can see if there's any notices there. But just because you don't receive a renewal in the mail doesn't necessarily mean coverage is going to get terminated. Sometimes I have seen individuals be protected for no reason other than the cases weren't closed in MassHealth's old system, and they've kind of cleared out some of those. So it can be case by case and sometimes random.
What's the eligibility of a permanent resident with citizenship application pending? Would that be the limited service that you mentioned?
If you are a legal permanent resident and can present your legal permanent resident card, you may have access to the MassHealth programs if you have met the 5-year bar. So there's a 5-year bar when you are a legal permanent resident that doesn't allow you to obtain MassHealth. However, a legal permanent resident who meets the requirements for connector care would be eligible for connector care based on income, employer-sponsored insurance, all of those things. And then once the 5-year bar passes, you would be eligible for a MassHealth program if you're income eligible.
My 24-year-old son is a DDS client who works part-time. Is income eligibility still the primary determinant of whether he gets MassHealth, or does being a DDS client make him qualified?
So I've just recently encountered this. So MassHealth, as far as I know, and again, I'm learning new things about MassHealth all the time. I've been doing this for 10 years and I still don't know everything. But MassHealth doesn't always recognize DDS disability. You have to go through the MassHealth disability process as well, unless they are deemed disabled by the Social Security Administration. Now, sometimes your loved one might be deemed disabled by the Social Security Administration, but not be receiving income for whatever reason, then they might be able to data match that disability determination. But if they are eligible with DDS, you've not applied for Social Security, my recommendation would be to submit the disability application to MassHealth. I will caveat that with is that MassHealth disability applications are processed by the Department of Disability Evaluation Services. That is an entity at UMass. And you do actually have to mail those in. So when I say don't send mail to MassHealth, this is the one situation where you're going to mail those documents in. Again, sometimes mail does get lost though. So in that case, you want to make a copy of all the information you sent.
And maybe send it certified mail, right?
Yes. Not always though, to be honest, when I send stuff to DDS, if I don't send them certified, it's not always common that they lose mail. It's when you're doing all of that like main eligibility documentation that MassHealth just gets inundated with that can be difficult.
So I've been informed by UMass Specialty Pharmacy that my son is not coded correctly in MassHealth. We've been paying co-payments for years. I called MassHealth and informed them, but they keep telling me that he does not qualify for the discount since we have private insurance and he has a Medicare plan as well. I'm not sure what to do at this point.
I'm just reading this too, so I get all the pieces. So if he's on MassHealth Common Health, your co-payments can be higher. However, it would depend on income, eligibility, and how the insurance is listed. So that's a really specific question that I can't give a great answer to unless I knew the entire situation.
So
But
where
yes,
what
if
would
you're
you
on
pursue?
MassHealth Common Health, you may pay a little bit more. However, if you're paying a lot more for prescriptions, then it would be most likely incorrect.
So
That is
how would you,
something you would want to discuss with a MassHealth expert who can actually look at MassHealth eligibility in MassHealth system and what exactly it looks like.
so a navigator? You think reach out to a
Or an
navigator?
application counselor or
Okay.
somebody who deals a lot with MassHealth.
So this might be another example that's a little too specific. My son was lost in the system. I went to the Springfield Mass Enrollment Office, resubmit disability, and then in February 2024, they had him on different programs. Nightmare calling the center that I was told that our family's primary insurance was not on his application. I'm trying to contact a former employer as I work for the same company my husband still works. So again, it's one of those situations where you've got to get specific help.
Yes. In this case, though, you want to make sure that the TPL indicator form has been submitted to MassHealth because that will help the primary insurance get added, which might help alleviate some of these things. Because it sounds like to me, he might have been auto-enrolled in a MassHealth plan because they don't see the primary insurance because it doesn't cross over. So when you do the application, even though you indicate that somebody has primary health insurance on the MassHealth application, it's going to help make the MassHealth determination, but it's not going to get that information added in MassHealth's billing system, which is where typically enrollments and things of that nature get triggered. So you want to submit that TPL indicator form with all of that primary insurance. Once that's done, the primary insurance will show first and whatever current enrollment is will be removed. It can
So,
take a while though. I've just submitted a couple forms to TPL. They just removed the insurance. It took about 2 weeks and sometimes you have to call, to nudge them. So it's not a foolproof process, but that would be very helpful.
so I think this question has to do with the My Health. It says this new site will not work for anyone with KM Mass Health. Where do KM Mass Health members get help?
Are you referring to the Kaylee Mulligan Mass Health? Like
I
in
think
terms of
so.
applying or I'm not sure. I would need a little bit more context.
Eileen, I don't know if you want to go on unmute and tell us what you mean by this question.
Yeah, it's families that are trying to apply because things fell through the cracks and like they're being told they need to reapply. And when they go online, it's like there's no clear place to find an application, like it's MassHealth, and then there's another part that says it's Kaylee Mulligan. It's like they seem to be two separate entities, although Kaylee Mulligan is a waiver program. So it's like, so is there a specific phone number of a person you could talk to? Because all we've gotten back and forth are emails, you know, that kind of thing. Nothing specifically talking to one person who's in charge of Kaylee Mulligan. So if we could find that phone number, we can help this family. Is there
So there's two different usually parts to this. One is the financial eligibility, which you're going to be doing with these forms that we discussed. And then the second would be the Kaylee Mulligan specific department.
right?
So are they financially eligible?
Well, the child is eligible for Kaylee Mulligan. With Kaylee Mulligan, you don't go by finances, but yeah, they already did the eligibility for MassHealth through the finances, yes. It's almost like you fill it out, and even if they make more money than what they would get from MassHealth, they're meeting the criteria of being medically complex and so complex that they would either be in a nursing home or hospital
Right.
or supports at home. So what we need is to talk to a human so that we can do the right, like you're talking about, there's so many forms, and this family wants to, there was a disconnect because they moved. And, you know, now we just really need to get this stuff done. And every time we ask somebody, we get a different answer.
So my first recommendation is to make sure that MassHealth has everything, the address is up to date, and all of the income eligibility or financial eligibility pieces that I've discussed in this presentation are up to date. And then I personally don't have a direct contact to people who do Kaylee Mulligan stuff, but maybe that is something Jackie and I could research.
That would be helpful.
Okay, we'll follow up with that.
Because the waiver piece is more clinical out, like there's two parts and two different entities, so that's where it can get confusing. And based on what you're saying, it sounds like the eligibility piece fell through the cracks because they moved and things didn't get updated. But it could be a combination of both.
Well, I think once the paperwork was not filled out, everything was just dropped. And so, I know that we've already done that because my coworker spent hours filling all that out 2 days ago. And then when he tried to get a response, the parent, they were telling him that they need a release to talk to him. And I'm like, the child is under the age of 10. And then it just got really difficult. I don't want to get into the whole thing, but the problem is that when you get to a certain point and you do all the right steps. And of course, Holly and I know all this because it's what we do. And you need to speak to someone. I was just wondering if years back, you would just pick up the phone and talk to somebody at Kaylee Mulligan. But I can't find that contact. So I didn't know if there was somebody who could help us with that, because that would be very helpful and save a lot of people a lot of aggravation. You know, instead of keep sending things to this person at MassHealth and that person at MassHealth, and that's
Okay.
what I'm trying to
We'll follow up online, and we're also going to be covering waivers in more detail for the MassHealth, the second one in the series. But we will follow up, Eileen, because I've got your contact information.
Thank you very much.
And when we had the question about the authorization representative, the ARD, you don't need that for a child. That's only for if you're over 18, correct?
That's what I thought,
Correct.
but figured I'd throw
Correct. You don't need it. It's only if you're over 18.
Okay.
You don't need to fill out an ARD for a child. However, if you're applying for your child only, you need to be listed as the head of household on the application if they're under the age of 19. You can't just apply for them.
Okay.
So let me just keep trying to get through these. My 19-year-old son is on MassHealth due to disability and receiving SSI. Should I set up an account for him at myservices.mass.gov or www.mass.gov virtual gateway my account, or both? What's the difference between those two?
I'm not exactly sure what the personal My Account page shows. I know that they've made this recent update to virtual gateway and My Account page. So if you're just looking for documents, I would set up the myservices.mass.gov. However, it may not show as like a typical, somebody who does Mass Health eligibility directly through Mass Health does, because sometimes Mass Health doesn't touch cases that are fully through SSI, but if you're looking to find those notices, my guess is my services should at least show you something. So I would start there.
So my 24-year-old son is covered by our primary insurance until he turns 26. Should we wait to apply until that time for Mass Health?
I mean, I would say no, you can apply at any time if he's disabled and he's over the age of 19. Typically, the insurance, even if you're claiming him as a tax dependent, your income wouldn't count. And then again, you want to submit that TPL indicator form so you don't have any billing issues. But then he could have your insurance as primary and the Mass Health secondary, which might help cover costs depending on his situation.
Mass Health has denied us for premium assistance since my son turned 22. So would that be an appeal situation or?
It's probably a correct determination because they no longer meet the requirements of the household. Unless he's standard or common health eligible, but I would need a little bit more context. That's something that's kind of unique.
Oh, okay. My 14-year-old son is autistic. Does it make sense for us to get additional coverage through Mass Health? They're currently getting insurance through his wife's employer with Aetna.
It depends on if they need specific services that are only covered by Mass Health. However, if they are, if he is not, if he's considered healthy, you may want to, if you haven't already, explore DDS eligibility.
Yeah, I'm sorry, DDS, Department of Developmental Services?
Yes.
Okay, what does that mean by eligibility? What do you,
Like you can apply for services through the Department of,
right?
have you
Yeah.
done that already?
No, I haven't done it yet, but I know of it. I guess my question is like, if I have Aetna and
Correct.
I have Mass Health coverage, could it cover deductibles? Could it do
It
that?
could, yes.
Okay,
So you could apply, however, there's all those income guidelines and then you might get a premium if you're well above income. So you have to kind of decide whether or not it makes sense for you and your family to go through that process.
okay, so you apply, I mean, I wouldn't be eligible for income assistance or anything like
No.
that. We're above that sort of amount.
So first you'd apply for traditional Mass Health through the website. Then you'd have to do a child disability, and then if that was approved, your son might be eligible for Mass Health Common Health, and then they would assess a premium based on all those factors. At that point, you could then decide if it makes financial sense for you guys to have it secondary.
So you said the first thing is to go Mass Health, and then the second thing is,
To apply for a disability.
okay,
So on that slide about Mass Health Common Health and Mass Health Standard, there's a link to the disability applications, and you can
Okay.
find the one for children.
excellent.
Right.
Thank you so much.
You're welcome.
And getting DDS eligibility it just gives you more options for
Yeah.
supports for him down the road, even if you don't need it now in 10 years, or you'll have to
Right.
then apply when he turns to be an adult. But
Gotcha. Thank you.
But DDS could help potentially cover some services now, depending on your
What he
area
gets.
office and who is already being served.
Gotcha. Thank you very much.
You're welcome.
if my son is on our employer-based insurance until he's 26, will the premium assistance look at his income and apply it to his portion of the private premium cost, or would premium assistance look at our total family income?
Typically, it looks at the total family income, and honestly, I would have to go back to the premium assistance regulations and check exactly what the qualifications are once someone is no longer considered a child, which is under the age of 19.
When submitting premium assistance, if I can't access a fax, can I go to the enrollment center?
To draw, yeah, I mean, you can mail the paperwork. You necessarily, if you have to mail paperwork, that's fine. Mail it to the specified mailbox on the application. And in that case, I would send it return receipt, so you can ensure that they received it.
At what age can a person apply for their own Mass Health without their parents being on it?
Typically, it's the age of 19. However, then if you're claiming them as a tax dependent, your income still counts unless they are disabled. So I recently just did an application where the individual turned 19. His parents are still claiming him as a tax dependent. He is disabled. So in which case he was able to be listed as the head of household, and then I had to include the parents on the application showing that they were claiming him as a tax dependent. However, if you are a typical household, no one is disabled in the household, and everyone, you claim them, everyone goes on the same tax form, then they cannot apply on their own.
I'm
I
from
ask-
out,
Can I
Oh.
just ask a question?
Sure.
Following up on that. So when you applied for SSI and you're applying on your own at 18, you
Correct.
can also apply for Mass Health. So would you not get approved for Mass Health till you're 19, or would you still get?
SSI, if you're approved, will automatically open a state Medicaid case, so they will automatically open the Mass Health case. However, if you're denied for SSI, I could be wrong, but I have not found a way to get somebody eligible for Mass Health Standard without applying in general, because you have to include mom and dad on the application. They're under the age of, not mom and dad, whoever the tax household is. And again, there are huge rules around who belongs in the Mass Health household. Like when I first started learning about Mass Health, like took weeks to learn who's always in a household in a blended family. So that's one caveat. They could apply, you could apply with the whole household and you claiming them as a tax dependent. Your income at that point would most likely count. And then if disabled, they would be eligible for the Mass Health Common Health Program if they're not income eligible for Mass Health Standard. Does that sort of make sense?
Yeah, it does. Okay, thank you.
It's weird. It's very weird.
Yeah.
Yes, it's weird.
Thank you.
so this question's, I'm from out of state trying to go to college in Boston, has been accepted to college in Boston. I'm having lots of trouble making this happen. Oh, I actually, if you want to speak, Jack, I see he said he's having trouble raising his hand. You're looking specifically for help with Mass Health, correct? Before you actually move here.
Yes, sorry. Can you hear us?
Yes. Hello.
Hi.
Hi. So I am an out of state like student, but I got accepted to a school in Boston. And the only thing I need to be able to go is PCA services, but I can't afford to private pay.
So unfortunately, you cannot apply for Mass Health unless you're considered a resident of the state of Massachusetts. And the requirement, you have to prove that you've been here and have an address. So there is no way to apply for Mass Health if you're currently living in a different state.
What if he has a letter from the college saying he's been accepted and he's going to be living at this dorm, or would that?
Typically, I haven't seen that happen. It's possible, but I would really encourage you, if you know where you're going to college, right? The university, it's in Boston. I would research enrollment, sister organizations in that area and reach out to one of them and see if they can provide some guidance or at least get you set up with an appointment right when you make the transition to Boston.
Okay, this is his mom, Jack's mom. We've been listening to this. So here's where we're running into a problem. And I just can't believe that we're in Ohio and in Massachusetts that Jack is the only person who's been on Medicaid, because he's on Medicaid in Ohio. He's on a Medicaid waiver, that has ever tried to go to college outside of their state. So we know, like, he can apply. He got a letter from Emerson saying, yes, he's living here. He did all this stuff. The problem we ran into was, because he was going to try to go in January, was that to get on Tempest, or what was the other one for the PCAs, it takes a couple months. So we kind of have to do stuff a little backwards, because he can't be off while so now he's not going till August. Fingers crossed that he's going to get there, but like, he can't get off Ohio Medicaid while he's still in Ohio to apply for Mass Health. And he can't apply for the PCA stuff till he's on Mass Health, and that takes a couple months. So we're kind of in this like really bad situation. We tried using my health insurance, which is Cigna, but in Massachusetts, in order to get a PCA, you have to be on Mass Health, we learned. And we're trying to do the opposite in Ohio. We're kind of learning the same thing, that my insurance, which covers 780 days of PCA services, you have to be on Ohio Medicaid as well. So we're like in this really, really bad situation and don't know how to get out of it. Like, if we could get the companies like Tempest to do the piece, if we could do that back work, like, and have it ready and then pull the trigger and say, okay, we're stopping our Ohio Medicaid and getting on MassHealth. It's just running into a thing, and we can't manage it. We don't live there. And everyone goes, oh, he can go to school in Ohio. Well, sure, he can go to school in Ohio, but that's not what his dream is. And I don't know, we just started so he's been really, really diligent and working and researching with you guys and everyone. And so he saw this and we're like, okay, let's get on here and see if we can find another creative way or some way to kind of do that back work and then pull the trigger when it's August and he's in Massachusetts. I know it's an unusual situation, but again, I cannot believe in the state of Ohio and the state of Massachusetts, that's never been an issue. I don't know.
It is an issue for a lot of people, not just trying to go to college, moving here. We
Right.
come across that same issue time and time again. And unfortunately, there is no way around indicating residency and then applying and then being placed on the wait lists for whatever services you're looking for behind those individuals who are already living in the state of Massachusetts. I wish I had a better answer, or if we could potentially look at agencies who might be able to support you. But then, once you even go through the PCA process, then if you don't have a PCA you have in mind, it can also take.
He has hired like 8 PCAs. He
So
has
he
like a
has
whole
already.
team that he hired because we
Okay.
thought January was happening. Because the mass health piece wasn't the problem. It was like, okay, with the other organizations, it's like, oh, it takes like a couple months. And it was like, wait. Like, I was going to go for a couple weeks with him, but I can't stay for months. I have to work and we have children at home. So it's just turning into this really frustrating thing. And we're just trying to figure out how can we make this happen? Like, it
Have you
shouldn't
talked?
be like this, but
Have you talked to the intake team at the PCA provider in the area?
yes, Jack, who have you talked to?
We
Tempest
talked
and
to Tempest and the BCIL.
BCIL and
And you
Tempest.
talked directly to the intake person or the intake office, the people who handle the intakes, and it wasn't just like a kind of somebody answering general questions?
I think there was an intake person, but I'm not 100% sure. Jack's been
You know what?
taking-
I'm gonna say, let's follow up with this after. I do have
Okay.
Jack's email address.
Okay.
And
Okay.
Jess, if you're willing to be on that email, we can try to brainstorm, but we've got a couple more questions and we're
Okay.
already over time.
Thank you. Appreciate it.
Can MassHealth cut the services of FCA to a person? Oh, that question's not continued.
I'm not sure what they mean by
Yeah,
FCA.
all right. A permanent who's permanently disabled. Can MassHealth cut the services of FCA to a person who's permanently disabled?
Do you mean PCA? Like, I
Maybe.
don't know. I don't know what the acronym FCA stands for.
Yeah, it must be PCA.
So the short answer to that
Yeah,
is
they can cut every year. They
Yes.
reevaluate them, and if they say you're not needing as much time as we thought you needed last year, even if the disability doesn't change, and there are ways you can advocate for that, which will be followed in our February 26th webinar on MassHealth 201.
or if the eligibility piece was not completed timely, yes, they will terminate your coverage.
If you want to apply for MassHealth for the first time for my 17-year-old son with autism, do I need to do it during the open enrollment period only?
No, you can apply for MassHealth or Health Connector coverage at any point in time. The fixed enrollment period is around enrolling in a specific MassHealth plan.
Oh, and I've got a comment here. I don't know if Jack is still on. Yep, it looks like he is. Diane, who's our education consultant here at the ARC, says, I'm reaching out to someone who went in college, was a Mass resident, attended college in Rhode Island, and I'm positive he was able to work through the system and get approved to use his MassHealth PCA service in Rhode Island. So maybe there is a way around that, and I'll include Diane in that email. I think I hit all the questions. Yep. Okay, so thank you all for sticking with us. Please do mark your calendars for the follow-up to this when we're going to do a deeper dive into long-term care services, adult family care, personal care attendance, the PCA program, the waivers, anything else you think you want to see in that follow-up webinar, please email me your thoughts about what would be helpful as we dig deeper into this situation. Jessica, thank you so much for your time today. Thank you all for sharing some time this afternoon.